What if I told you that the position you sleep in tonight could be the difference between waking up healthy tomorrow or not waking up at all? I know that sounds dramatic, and I know that sounds like something designed just to scare you, but I promise you, by the time you finish watching this video, you're going to look at your bed completely differently. You're going to look at your pillow completely differently, and you're going to understand something about your own body that most people, and I mean the vast majority of people walking around right now, have absolutely no idea about. This is not some secret that's hidden in obscure medical journals that nobody reads. This is well-documented science. This is something that cardiologists know, that vascular surgeons know, that neurologists know, and yet somehow it never makes it to the general public. Somehow, this incredibly simple, completely free, zero-effort change that you can make tonight, right now, today, before you go to bed, never gets talked about in the way it deserves to be talked about. And that is exactly why I'm making this video. Because if this helps even one person avoid a stroke, if this helps even one person reduce their risk of a blood clot, if this helps even one person take a little bit of pressure off their heart while they sleep, then every single second I spent putting this together was worth it. My name is Dr. Clarence Martin, and welcome back to the channel. If you're new here, this is where we break down real medical science into language that actually makes sense, language that you can use, language that you can apply to your life starting today, and I always ask you to do one thing for me. If at any point during this video you learn something new, something you didn't know before, just tap that like button. That's it. That one small action helps this video reach more people, and when we're talking about something as serious as heart health and stroke prevention, reaching more people literally saves lives. So keep that in mind as we go through this together. Now let me set the stage here. Every single night you spend somewhere between 6 and 9 hours in one position or a combination of positions. Think about that for a second. That is a third of your entire life spent lying down. A third of your life where gravity is acting on your body differently than it does during the day. A third of your life where your blood is flowing through your vessels at a different angle, under different pressures, with different dynamics than when you're standing or sitting. And most people never ever think about what that means for their cardiovascular system. They think about their mattress. They think about whether their pillow is comfortable. They think about whether they're going to wake up with a stiff neck. But they never think about what their sleeping position is doing to their heart, to their blood vessels, to the flow of blood through their brain. And honestly, that's a massive blind spot because the research on this is fascinating and frankly, it's kind of alarming when you realize how much your sleeping position actually matters. So let's talk about it. Let's talk about the position that research and clinical experience have shown to be the most beneficial for your heart, the most protective against strokes, and the most helpful in preventing dangerous blood clots, which we call thrombosis in the medical world. And that position, the one I want you to really pay attention to, is sleeping on your left side. Sleeping on your left side. It sounds almost too simple, doesn't it? It sounds like one of those things where you think, come on, Dr. Martin, how can which side I sleep on possibly make a difference to something as serious as a stroke or a heart attack? And I completely understand that skepticism. I would be skeptical too if I hadn't seen the research myself, if I hadn't seen the anatomical reasons why this works, if I hadn't understood the physiology behind it. So let me walk you through this step by step, and by the end, I think you're going to be just as convinced as I am. Let's start with the heart. Your heart is not sitting perfectly in the center of your chest. I know a lot of people think it is. I know when you put your hand over your heart, you put it right in the middle. But anatomically, your heart is positioned slightly to the left side of your chest. It's tilted. It's angled. The apex of your heart, which is the bottom pointy part, points toward your left side. Now, when you lie on your left side, gravity actually assists the heart in its pumping function. Think about what that means. Instead of your heart having to work against gravity or work in a neutral position, gravity is actually giving it a little bit of help. It's like the difference between pushing a cart uphill versus pushing it on a flat surface versus pushing it slightly downhill. When you sleep on your left side, you're giving your heart that slight downhill advantage. And over the course of 6, 7, 8 hours of sleep, that reduced workload adds up. It adds up significantly. Now, some of you might be thinking, okay, but the heart is a strong muscle. It doesn't need help. And you're right. In a healthy young person, the heart is incredibly strong and efficient. But here's the thing. Not everyone watching this is a healthy 25-year-old with perfect cardiovascular function. Many of you have high blood pressure. Many of you have early signs of heart disease. Many of you have family histories that put you at elevated risk. Many of you are over 50, over 60, over 70, and your heart has been working nonstop for decades. For those people, and honestly for everyone, reducing the workload on your heart during sleep is not trivial. It's meaningful, it's significant, and it's completely free. You don't need a prescription, you don't need a supplement, you don't need a special device. You just need to roll over to your left side. But the heart benefits don't stop there. Let's talk about something called venous return. Venous return is the process by which blood that has been used by your body, blood that is now deoxygenated and carrying waste products, returns to your heart so it can be pumped to the lungs, reoxygenated, and sent back out again. This is a continuous cycle, and the efficiency of this cycle matters enormously for your overall cardiovascular health. Now, the main vessel responsible for returning blood from your lower body back to your heart is called the inferior vena cava. This is a large vein, and here's what's critical. It runs along the right side of your spine. When you sleep on your right side or on your back, you can actually compress this vein. You can put pressure on it, and when you compress the inferior vena cava, you reduce venous return. You make it harder for blood to get back to your heart. This means your heart has to work harder to maintain circulation. It means blood can pool in your lower extremities. It means the overall efficiency of your cardiovascular system decreases while you sleep. But when you sleep on your left side, you take the pressure off the inferior vena cava. You allow it to function without compression, without obstruction. Blood flows freely back to your heart. Venous return improves. Your heart doesn't have to work as hard. Circulation throughout your entire body improves, and this, my friends, is where we start connecting the dots to stroke prevention and thrombosis prevention. Let me explain thrombosis first, because I think a lot of people hear that word and they don't fully understand what it means or why it's so dangerous. Thrombosis is the formation of a blood clot inside a blood vessel. Now, blood clotting is normally a good thing. When you cut yourself, you want your blood to clot so you stop bleeding. That's your body's natural repair mechanism. But when a clot forms inside a blood vessel, when it shouldn't, that's when things get dangerous. That clot can block blood flow. If it blocks blood flow in an artery that feeds your heart, that's a heart attack. If it blocks blood flow in an artery that feeds your brain, that's a stroke. If it forms in the deep veins of your legs, that's called deep vein thrombosis, or DVT. And if that clot breaks loose and travels to your lungs, that's a pulmonary embolism, which can kill you within minutes. So what causes these dangerous clots to form? There are three main factors, and they were actually described way back in the 1800s by a physician named Rudolf Virchow. We call them Virchow's triad. The three factors are stasis of blood flow, meaning blood that's not moving well or is pooling, damage to the blood vessel walls, and hypercoagulability, which means the blood itself is more prone to clotting than it should be. Now here's what I want you to focus on. That first factor, stasis, blood that's not moving, blood that's pooling, blood that's sitting in one place for too long. When does that happen most in your life? When you're sleeping. You're lying still for hours. You're not moving. Your muscles aren't contracting to push blood through your veins the way they do when you're walking around during the day. This is why long-haul flights are dangerous for blood clots, and this is why sleeping position matters so much for thrombosis prevention. When you sleep on your left side and you optimize venous return, when you take the pressure off that inferior vena cava and allow blood to flow freely, you are directly combating that first factor of Virchow's triad. You are reducing stasis. You are keeping blood moving more efficiently even while you're lying still, and that means you are reducing your risk of forming dangerous clots. This is not theoretical. This is basic vascular physiology. This is how your body works. And the beauty of it is that you can take advantage of it simply by choosing to sleep on your left side. Now let's talk about strokes, because this is where things get really important and really serious. A stroke occurs when blood flow to a part of your brain is interrupted. There are two main types: an ischemic stroke, which is caused by a clot blocking an artery in the brain, and a hemorrhagic stroke, which is caused by a blood vessel in the brain bursting. Ischemic strokes account for about 87% of all strokes. So when we're talking about stroke prevention, we're primarily talking about preventing clots from forming or traveling to the brain. Now, we've already talked about how left side sleeping can reduce blood stasis and lower your risk of clot formation. But there's another mechanism at play here that I find absolutely fascinating, and it has to do with something called the glymphatic system. The glymphatic system is essentially your brain's waste removal system. During sleep, your brain actually shrinks slightly, and cerebrospinal fluid flows through the spaces between brain cells, flushing out waste products, including a protein called beta amyloid, which is associated with Alzheimer's disease, and other metabolic waste that can contribute to inflammation and vascular damage in the brain. Here's what the research has shown. A study published in the Journal of Neuroscience found that the glymphatic system works most efficiently when you sleep on your side, and particularly when you sleep on your left side. This means that waste is being cleared from your brain more effectively, inflammation is being reduced, and the blood vessels in your brain are being protected from the kind of damage that can lead to strokes. This is remarkable. This is your brain literally cleaning itself more effectively based on the position you sleep in. And most people have no idea this is happening. Let me also address something that a lot of people experience but don't necessarily connect to their cardiovascular health, and that's acid reflux or gastroesophageal reflux disease, GERD. Now, you might be thinking, Dr. Martin, what does acid reflux have to do with heart health and strokes? And it's a fair question, but here's the connection. When you have chronic acid reflux, the acid that comes up from your stomach can cause inflammation in your esophagus. Chronic inflammation anywhere in your body contributes to systemic inflammation, and systemic inflammation is one of the major drivers of atherosclerosis, which is the buildup of plaque in your arteries. Atherosclerosis is the underlying cause of most heart attacks and many strokes. So, reducing acid reflux is not just about comfort. It's about reducing a source of chronic inflammation that can damage your blood vessels over time. And guess what? Sleeping on your left side has been shown to significantly reduce acid reflux. The reason is anatomical. Your stomach is positioned in such a way that when you lie on your left side, the junction between your esophagus and your stomach is positioned above the level of stomach acid. Gravity keeps the acid down in your stomach where it belongs. When you lie on your right side or on your back, that junction can be at or below the level of stomach acid, making it much easier for acid to flow up into your esophagus. So by sleeping on your left side, you're not only helping your heart directly, you're also reducing a source of chronic inflammation that contributes to cardiovascular disease over the long term. It's like a cascade of benefits, one thing leading to another, all from this one simple change. Now, I want to talk about blood pressure for a moment, because this is relevant to a huge number of people watching this. High blood pressure or hypertension is one of the single biggest risk factors for both heart disease and stroke. It affects nearly half of all adults, and managing blood pressure is a constant challenge for many people. They take medications, they watch their sodium intake, they try to exercise, they try to manage stress, and all of those things are important. But here's something that rarely gets discussed in the context of blood pressure management. Your sleeping position affects your blood pressure during the night. When your heart doesn't have to work as hard, when venous return is optimized, when circulation is flowing smoothly, your blood pressure during sleep tends to be lower and more stable. There's a concept in cardiology called nocturnal dipping, which refers to the natural decrease in blood pressure that should occur during sleep. People whose blood pressure doesn't dip adequately during sleep, we call them non-dippers, are at significantly higher risk for cardiovascular events, including heart attacks and strokes. Optimizing your sleeping position to support cardiovascular function can help promote healthy nocturnal dipping. It's not the only factor, of course, but it's a factor, and when we're talking about something as serious as heart disease and stroke, every factor matters. Every small advantage you can give yourself adds up. I also want to address pregnant women specifically, because this is a population where sleeping position is not just important, but can be critically important. During pregnancy, the uterus grows and can compress the inferior vena cava when a woman lies on her back. This can reduce blood flow to the heart and to the placenta, which can be dangerous for both the mother and the baby. This is why obstetricians have been recommending left-side sleeping for pregnant women for decades. It optimizes blood flow, it reduces swelling in the legs, it supports kidney function, and it helps ensure adequate blood supply to the placenta. If you're pregnant, or if you know someone who is, this is not optional advice. This is essential. Sleep on your left side. It matters enormously during pregnancy. Now, let me give you some practical tips, because I know that hearing all of this is one thing, but actually changing your sleep position is another. A lot of people have been sleeping on their backs or on their right sides or on their stomachs for their entire lives, and changing that habit is not easy. So here are some things that can help. First, try placing a body pillow or a regular pillow behind your back when you lie on your left side. This creates a physical barrier that prevents you from unconsciously rolling onto your back during the night. It's a simple trick, but it works remarkably well. Second, if you find that lying on your left side puts uncomfortable pressure on your shoulder or hip, try placing a pillow between your knees. This aligns your spine, reduces pressure on your joints, and makes the position much more comfortable. A lot of people who say they can't sleep on their side simply haven't tried it with a pillow between their knees, and once they do, they find it's actually very comfortable. Third, give yourself time to adjust. You're not going to change a lifelong habit overnight. It might take a week, it might take 2 weeks, it might even take a month before left side sleeping feels natural. But stick with it. The benefits are worth the adjustment period. And fourth, if you have a specific medical condition, if you have severe heart failure, if you have certain shoulder injuries, if you have other conditions that might affect which position is best for you, please talk to your doctor. I'm giving you general guidance based on what the research shows for most people, but everyone is different, and your personal medical history matters. Never make changes to your health routine without considering your individual circumstances. I want to circle back to something I said earlier because I think it's so important that it bears repeating. We spend roughly a third of our lives sleeping. A third. That's 25 to 30 years for most people. And during all of that time, the position we're in is affecting our cardiovascular system, our brain health, our digestive system, our lymphatic drainage, our blood pressure, and our risk for some of the most serious and most common causes of death and disability in the world. Heart disease is the #1 killer globally. Stroke is a leading cause of long-term disability. Deep vein thrombosis and pulmonary embolism kill hundreds of thousands of people every year. And here we have a simple, free, accessible intervention that can reduce risk across all of these conditions, and most people don't even know about it. That's what frustrates me as a physician. That's what drives me to make these videos. Because the information is there, the science is there, the evidence is there, but it's not reaching the people who need it most. It's sitting in medical textbooks and research journals and academic conferences, and meanwhile, people are going to bed every night in positions that are making their hearts work harder than they need to, that are promoting blood stasis in their veins, that are increasing their risk of clots and strokes without even knowing it. And that's not okay. That's not acceptable to me. So please, if you found this information valuable, share this video. Send it to someone you love. Send it to your parents, your grandparents, your friends, your partner, because this is the kind of information that can genuinely, truly, literally save someone's life. Let me also address a question I know some of you are going to ask, which is whether sleeping on your left side all night long is necessary or whether it's okay to shift positions during the night. And the answer is, of course, you're going to shift positions during the night. That's normal. That's natural. Your body moves during sleep to relieve pressure points and to maintain comfort. You don't need to stay rigidly on your left side for 8 hours straight. What you want to do is make left side sleeping your default position. Start on your left side. If you wake up during the night and find you've rolled over, gently shift back to your left side. Over time, your body will naturally begin to favor this position, and even if you spend some of the night in other positions, spending the majority of your sleep time on your left side will still give you significant benefits. I also want to mention that sleeping on your stomach is generally the least recommended position from a cardiovascular standpoint and from a musculoskeletal standpoint. When you sleep on your stomach, you have to turn your head to one side to breathe, which puts strain on your neck and can compress blood vessels. You're also putting pressure on your chest, which can affect breathing mechanics and cardiac function. And your spine is in an unnatural position, which can lead to back pain and nerve compression. So if you're currently a stomach sleeper, I would really encourage you to work on transitioning to side sleeping and specifically left side sleeping for all the reasons we've discussed. Now, I want to be very clear about something before I wrap up. Sleeping on your left side is not a cure for heart disease. It is not a replacement for medication if your doctor has prescribed it. It is not a substitute for a healthy diet, regular exercise, stress management, not smoking, and all the other pillars of cardiovascular health. What it is an additional tool in your toolkit. It's another layer of protection. It's another way to support your body's natural functions and reduce your risk. And the beautiful thing about it is that it costs nothing. It requires no special equipment, and you can start doing it tonight. That's the kind of health advice I love giving because it's immediately actionable. Think about it this way. If your doctor told you there was a pill you could take every night that would improve your circulation, reduce the workload on your heart, help clear waste from your brain, lower your blood pressure during sleep, reduce acid reflux, and decrease your risk of blood clots, strokes, and heart attacks, and that pill had no side effects and was completely free, would you take it? Of course you would. Everyone would. Well, sleeping on your left side is that pill. It's that simple. It's that powerful. And it's available to you right now. So tonight when you get into bed, I want you to roll over to your left side. Put a pillow between your knees if you need to. Put a pillow behind your back to keep you in position. Close your eyes, take a deep breath, and know that you're doing something meaningful for your heart, for your brain, for your blood vessels, and for your long-term health. You're giving your body the best possible conditions to heal, to regenerate, and to protect itself while you rest. I'm Dr. Clarence Martin, and I hope this video has given you information that you can use, information that makes a real difference in your life. If it did, please hit that like button, subscribe to the channel if you haven't already, and turn on notifications so you don't miss future videos where we break down important health topics just like this one. Leave me a comment below and tell me what position you usually sleep in. I'm genuinely curious, and I read every single comment, and if you have questions, ask them in the comments. I'll do my best to respond and address them in future videos. Thank you for watching. Thank you for trusting me with your time and your health. Take care of yourselves, take care of each other, and I'll see you in the next one. Good night and sleep well on your left side.